Hi, everyone. Thank you, Maggie. So, as Maggie said, I'm the medical director of Pentavere. And what we do at Pentavere is we use natural language processing and machine learning algorithms to replace manual chart abstraction. We take unstructured clinical notes, run them through our engine, and produce structured data sets at the end. And that provides insights to our clients to change healthcare. And this is why I was invited to speak today. But this is relatively new for me, and prior to this, I spent my working career, as Maggie said, as a surgeon. And that meant I spent the majority of my career working in an industry where we taught to resist change. We we don't embrace technology. We still use faxes. It wasn't that long ago that I was getting bleeped to emergencies and I would handwrite my op notes. So with that in mind, it's kind of fairly daunting talking to a room full of innovators. So what I want to do is spend the next 4 minutes just trying to explain some of the reason for this resistance to change, because I think if we all understand why that resistance exists, then we can actually use it to drive forward the meaningful work we do. So while you've all been taught to innovate or have learnt it during the course of your careers, in medical school and throughout our clinical careers, we're taught the exact opposite. We're taught to resist change, and we're taught to just follow the rules. And the reason for this is fear of the consequences if we get it wrong. I can tell you that when my hospital switched from pagers to mobile phones, the new signal was so bad that actually they couldn't get a hold of me in the emergency room or the operating room. And this has potentially disastrous consequences. What if they can't get hold of me if a patient's sick? What if a patient dies? And so it's this fear of consequences that leads to the resistance to implement change. But for me, this fear of consequences also meant that it held me back. It meant that I wasn't embracing change and I didn't want to embrace technology. I would sit with my colleagues or my friends and I would kind of grumble about how I thought the healthcare system was failing patients and we could do better. But myself and my colleagues, we would kind of silently resolve to just work harder to fill that gap. We wouldn't decide to embrace change or new technologies. And it took a while, but I realized eventually that I was thinking about it all wrong. And that actually, because of the opportunity cost, what we should have been fearing is the consequences of not acting. So this is Iffley Road Sports Stadium. I used to train here when I was at med school, and although it doesn't look like much, in 1954, it was the site of Roger Bannister becoming the first person to break the 4-minute mile. So he ran a mile in under 4 minutes, an incredible feat of human achievement. And many years later, I was lucky enough to meet him. And he described that day to the audience about how he left a shift in London. He was a med student at the time, got on a train to Oxford, and the conditions were pretty poor, actually. It was very blustery, much like today. But despite all of this, with a good team behind him, he achieved in his remarkable feat. But far more interesting for me was actually when he described his decision to break away from the pack, his decision to make his move and sprint for the finish, because he did this a full lap before the end of the race. And he said that, sure, it was driven by confidence that he could sprint away from the pack and maintain that speed right through to the end of the race. But actually, he said that more than that, it was driven by fear that if he didn't make his move, then someone else might. Or worse, on that particular day, if he didn't make his move, that no one else would. The race would finish, maybe he'd win, but no records would have been broken, no feat would have been achieved, no impact would have been made. And for me, the learning from this story is that we've got to seize our moment or risk it passing forever, that if you don't do it, who else will? And really, that's what drives us at Pentavere. I know as a clinician that information is key. We need information to make our diagnosis, to make our treatment plans, and to make an accurate prognosis. And at Pentavere, we get that information out of the clinical notes, and we put it in the hands of people who can make a change to patients' lives. So I have a confidence that what we're doing is going to change healthcare, but I also worry if we're not going to do it, who will? Healthcare's hard. No one's suggesting it's not. We all know that many ventures are going to fail, but everyone here in this room tonight knows how important the work is, and I'm sure many of you have big ideas. And in healthcare, those ideas literally can save lives. So I think my closing message to you, my last 10 seconds, is I really don't want you to let fear stand in the way of your big ideas, because I think you should be more fearful of what happens if you don't make your move. Thank you.